Hi, this is Dr. Derek. Today I'd like to talk to you about adhesive scar tissue. Adhesive scar tissue is often the cause of your pain, decreased range of motion, lack of function, and suffering. And it's a hidden problem that many people are not addressing, or they do not know how to address, or don't have the tools how to address it properly. So today I'd like to talk to you about how adhesive scar tissue will cause problems here for you. So what is adhesive scar tissue? Well, your muscles are made out of fibers that run together like this. So what happens when you have a traumatic injury, a traumatic injury like a fall or a sprain or a strain or a repetitive use injury, what'll happen is or even a surgery, something that pokes through the skin, you'll separate those fibers and that creates a disruption there. How does your body respond? Your body responds by sending blood to the area. There's hence inflammation. And it'll send little cells here called fibroblasts, and it'll cause a repair in this area here. So now the tissue is actually shortened. So instead of your muscles looking like this, your muscle is shortened because all the scar tissue pulls those two fibers together. The muscle is shortened, decreased blood flow, decreased nerve flow, increased pain, decreased range of motion. This is the cause of a lot of people's problem and their pain. So when you have an injury and you have that initial scar tissue form, you have that injury there, scar tissue is going to form. It is imperative that you get treated right away. If you get it treated right away, you're going to decrease your pain, suffering, and it's going to save you a ton of money in the long run because this is going to heal properly. And it's so much easier to repair and fix at initial injury. I tell my patients, it's like, here's my white lab coat here. It's like, if I accidentally spilled some grape juice on this, if I went and got it washed right away, I can probably get it out. However, if I just let it sit and wait, that stain is going to be in there, it's going to be permanent, it's going to be long lasting, and it's going to ruin the coat. Same thing with your muscles and injuries. You injure the muscle, you get it taken care of right away, huge changes. It'll just save you a ton of headaches. No pun intended, it will cause headaches, these adhesive scar tissue, but it'll save you a ton of headaches, time, energy, and money. So this is important that you get treated by a doctor who specializes in adhesive scar tissue immediately after an injury. So one of the things that we have just added to our office is energy pressure wave technology. This is phenomenal technology. In 22 years of practice, I have not seen anything that works as incredible in reducing and eliminating scar tissue like this technology. Here's an example of what the machine looks like here, and it's pretty incredible. This machine is typically used in Europe, and in the United States it's mostly used in orthopedic offices, more so than chiropractic offices. But it has different tips for different penetrating lengths, strengths, and it goes in there and it breaks up scar tissue like nothing else. And so it has the ability to take care of issues and problems within 1 to 3 treatments. Everybody's different, but this has one of those potentials to create that kind of effect. It's that powerful. However, there's a double-edged sword with this. If you go really aggressive with this, you can be pretty sore and uncomfortable for about a week or so after a treatment. So it kind of depends on your comfort level and how fast you want it to get better, and how few treatments you want to do, and how much you're willing to pay the price in order to get the results that we're looking for. So I'm going to give you now a demonstration of how this technology works. First, let me tell you what it does. What it does, it provides an intense radio and acoustic waves that penetrate in and actually helps to regenerate damaged tissue. It breaks up scar tissue so that it heals properly and forms, even if you have waited a long time to get your adhesive scar tissue corrected. So if you have an old chronic injury or chronic pain that you haven't been able to get rid of, this is phenomenal for taking care of that kind of issue. So it reduces scar tissue, regenerates damaged tissue, it increases blood vessels to the area so the body can heal itself. It has an analgesic effect, it helps stimulate tissue and bone growth, it reduces inflammation, and used properly, this has profound effects on one's health. I'd like to give you a demonstration now of how this works. This is the machine, and we're going to work on Callie's. She has a problem with her wrist. She has pain in her wrist. I just did an evaluation before, and actually the wrist pain is not coming from the wrist at all. It's actually coming from the elbow. So I'm going to show you what it looks like to get a treatment here. We're going to do a treatment on the elbow. Now, Callie, you've never had a treatment like this before, correct? So you're going to feel what it feels. I'm going to put the coupling gel on it. So it's a conductor. And let's see your elbow right through here. So I'm going to turn it on. Is it okay? Kind of scared her a little bit. So makes a little bit of a noise. And so the areas where she has the problem, it'll be a little more uncomfortable. Is this uncomfortable right over here?
Right there.
Right there? So she'll feel where it's more uncomfortable. So the body will tell you where to work actually. And then we combine that with the tailored method, and the results, we can actually pinpoint exactly where the pain is coming from and the area of scar tissue that's causing the problem. So we're going to do 2,000 pulses on her in just a few minutes. How does it feel over here? A little sore. So it's a little uncomfortable. So we're going to start out very lightly, and we're just going to do a very light treatment on her. You can see, if you zoom in on this area, you can see that it's already increasing blood flow to this area. As I mentioned before earlier in the video, scar tissue will have decreased blood and nerve flow. So you can see right there, it's becoming a little more pink and a little more red. And that's blood and circulation flowing there like there's no tomorrow. So, doing okay? Yeah. A little uncomfortable right there? It's a little uncomfortable. She didn't even realize she had an elbow problem. When I took a history though, she says that when she works out in the gym and works her arms, she has a zinger that goes into her elbow. But she didn't equate that with the wrist. And that's the advantage of having the tailored method where we can pinpoint exactly where the problem is coming from. So, you doing okay? Good. How's it feel right over through here? Not as bad? So her main problem is coming from like right in through here. So this is basically how it works. And we did about 1,600 pulses. Normally we do 2,000, but for time purposes, we're going to check now. Hold this arm up strong like this and raise this. That's going to help her wrist quite a bit. Thank you very much. So that is a demonstration of how the machine works. Today I had a gentleman in my office that came. He was in a surfing accident. He actually injured his wrist surfing, and then later on down the line he injured it in a car accident, and he had so much scar tissue built up he could barely move his wrist. Here's a young man here who was told by his orthopedic surgeon that, you know, it's okay right now, but eventually later on down the line you're probably going to have to get some type of surgery here to correct all the scar tissue and fix that problem there for you later on. It's just going to happen. Well, he came in barely being able to use the wrist, and he had chronic pain that was like on a level of 4 out of 10. That was just there constantly. So we did a treatment on him, and just a brief treatment. I didn't go too much because I didn't want him to be too sore, and that alone increases range of motion quite a bit, and it helped decrease the pain quite a bit. And so this has, if you've had scar tissue that's old from an old injury, a car accident, even an old surgery, now that you have scar tissue built up from a surgery someplace, this is phenomenal for breaking that up in an efficient, fast, and quick manner. So I hope this video has been helpful, and if you do have scar tissue, there's nothing like the energy pressure wave therapy technology to help clear it. Thank you very much for watching.
Hi, my name is London Theodora. I had problems with my wrist. I originally broke my wrist surfing. I had some work done on it, felt a little better, and then I broke it again in a car accident. My hand went through the windshield. Ever since then, I've had pain in my wrist. I haven't been able to bend my wrist fully 90 degrees. The most I could do is maybe about 45 to 50 degree bend on my wrist. Dr. Taylor just did this energy pressure wave therapy, this new technology. I started at a 4 pain today, and I'm down to a 2 pain, and I can almost go 90 degrees, which is quite impressive, and it's given me hope that my right arm might be able to function as it used to. So thank you, Dr. Taylor.